Good morning, everyone, and thank you for joining us today for this edition of STEMinista Live. My name is Andrea Harp, and on behalf of the Michigan Science Center, I would love to welcome you to our program today. Today, we're going to be talking all about germs with some very special friends of ours, which I'll introduce shortly. But before I do that, I would love to let you know about our free Summer of Science that we have going on at the Michigan Science Center starting now until I believe the end of August, which basically means you can come and visit the Michigan Science Center for free. All you have to do is go on to our website at www.mysci.org and you can reserve your free tickets today. We are very much taking our precautions to stay safe and keep you safe as our guest. So please check that out if you're interested. We love, love, love to have you as our special guest. So without further ado, I would love to introduce our friends from Replenish Detroit. We have Shanmeen and Jasmine, who are from a Wayne State student group, again, called Replenish Detroit, that focuses on access to water, clean water, and really advocating for those who don't have access to those very, very necessary items. So without further ado, welcome ladies, and thank you for joining us. And what are you going to be talking to us about today?
Sure, thank you, Andrea, for that wonderful introduction. Hi everyone, my name is Shanmeen Sultana.
And my name is Jasmine Minhas.
And we are undergraduate students at Wayne State University and directors of a student organization called Replenish Detroit. Replenish Detroit aims to address public health issues that stem from social issues with a focus on the water affordability crisis in Detroit, as Andrea had mentioned. So low-income people living in Detroit have been struggling to pay expensive, increasingly high water bill rates in Detroit over the past decade, which have doubled. And so when residents aren't able to meet their water bills on time, then their water is shut off.
So obviously living without running water in your home makes everyday activities very difficult to do. Things like cooking, cleaning, or even washing your hands are activities that are very difficult. So even during the first few months of the coronavirus pandemic, thousands of people that are living in Detroit were living without water because their water was being shut off. So the goal of Replenish Detroit is to work to raise awareness about this public health issue and the importance of providing affordable running water for everyone during and after the coronavirus pandemic. So now I'd like to introduce Anna Sterner from the Michigan Science Center on screen, who will begin walking us through the glow germ demonstration.
Thank you, Jasmine and Shanmeen. My name is Anna, and I work with the Michigan Science Center's Distance Learning Program. Maybe you've seen an episode of Echo Live in the past. If you follow the Michigan Science Center on Facebook or YouTube, I host weekly activities on our free science show about a variety of STEM topics. And today I'm here to do a hands-on demonstration that shows just how important access to running water is to good hand hygiene. Now, if we take a look at my hands here, they might not look like anything special. Perhaps they look pretty clean to our naked eye, but the point of this demonstration is to show us what is on our hands that we can't necessarily see. Now, before we started up this program today, I rubbed a special lotion all over my hands that contains something called glow germ. Now, glow germ comes in this tiny little bottle, and this is what we call a phosphorescent powder, or you might more know that word as glows under UV light. So if I take my UV flashlight here and I shine it on the bottle, you can see that it phosphoresces. Some of the atoms inside this glow germ powder, when they react with the UV light, they emit a new color of light back at our eyes. Now, this demonstration isn't super easy to see here on camera if I shine the UV light on my hands, but don't worry, I have another camera here to use to show this off. Now, down underneath this box, I just want to show you what my hands might look like under the UV light now that they're coated with that glow germ powder. And you can see down here in the dark, under that UV light, there is all sorts of junk all over both sides of my hand. Every little speck of phosphorescent powder can represent something like a germ or a virus that's living on your hands. Now it's especially bad right around my fingernails, but it's not just on my hands, right? Anything that my hands have touched may have also been exposed to some of those phosphorescent molecules or our pseudo germs. Now, things like our glassware, you can see, are just covered in it, right? And this is something that you put in your mouth. So that's pretty gross. I also have, things like pens. Those can be coated with this glow germ powder as well, right? And there are a couple solutions, right, that I'm sure we're all aware of how we can try to keep our hands clean. Now, one thing you could do, right, is take something like a disinfectant wipe. And I know we use these a lot. I carry them with me everywhere to disinfect some surfaces while I'm out in public lately. But I'm going to wipe my hands as best as I can with our disinfectant wipe here. I'm going to try to get off as much of that glow germ powder as I can. And then let's take another close-up look at what my hands look like. All right, I've done my best job here with that wipe. And you can see that I've removed a lot, but certainly not all of that glow germ powder. It's still extremely prevalent down there in the creases of my hands. And it didn't do a great job getting those pseudo germs off of my fingernails, right? But if we want to get the germs off, right, you might be familiar with the fact that you need to wash your hands with running water for at least 20 seconds and using soap. Soap has special properties that break up virus membranes, break up bacteria, right, and wash it down the sink. Now, I'm going to wash my hands in the sink for about 20 seconds, just like the CDC recommends, and then we'll take one last close-up look at our glow germ powder, and we'll see how good of a job I did. So turn on our water here, use a little bit of soap, and start scrubbing. Now, of course, it's important that I get the entire surface of my hands, that I get under my fingernails, up on my wrists, because anything I touch could be covered in that glow germ powder. And if we were out in public, right, that means that germs could be all over my hands as well. Now, 20 seconds feels like a long time when you're on camera. And I'm sure it feels like a long time at home, but that is the amount of time that you need to wash your hands in order to feel confident that you've done a good job removing as much of that dirty junk as possible. We'll go ahead, we'll rinse our hands off here. Give them a quick dry, and then let's take one more close-up look and see if I did a good job washing my hands today. Now, it looks like I did pretty well. There's certainly still a little bit on some of the parts of my hand, maybe still a little bit under my fingernails there, especially on my thumb, right? But running water and using soap in the sink is clearly our best option, much better than these temporary solutions, which it's okay to use wipes when you're out in public, right? And you don't have access to running water, but they're not a perfect solution. So good hand hygiene is really the only way to prevent germs from spreading all over. Now, we've also heard that it's important not to touch your face during this time, right? And I will admit that I am what you might call a chronic face toucher. It's definitely been my biggest area of growth over the last few months, trying not to touch my face as much as possible. But if you're like me and you have longer hair, you might do what I do. And every time I go to take my hair out of my face, right, you can see some of that glow germ powder, right? That represents germs that I could be picking up from various contaminated surfaces, wiping on my face, touching my mouth, and that's not so great. So now that we've covered our hands-on demonstration part of the episode, I'm going to throw it back to Replenish Detroit, who are going to introduce our next expert on the topic.
All right, thanks so much, Anna, for showing us that really cool demonstration. So now we'd like to bring on screen our STEM female role model, Dr. Tina Chopra. So Dr. Chopra is an infectious disease specialist and professor of internal medicine and infectious diseases for the Wayne State University School of Medicine. Dr. Chopra also serves as the corporate medical director of infection prevention and hospital epidemiology at the Detroit Medical Center. Welcome, Dr. Chopra.
Thank you, Sharmeen and Jasmine and Michigan Science Center for having me today. It's a pleasure to be here and to be able to share some of my experiences with you guys.
Yes, thank you for lending us your time. So we'd like Begin by asking you if you could share with us why you chose to pursue medicine as a career field.
Sure. I'm from India, from North India, and I come from a family of physicians and educationalists. So growing up, I saw the value of helping others. I saw the value of the gratification you get in making a difference in others' lives, whether you are a physician or you are a teacher. So both the professions attracted me, and here I am, so many years from my childhood, where I was inspired by both the professions, and now I'm doing both of them because I'm not only a physician, but I'm also a mentor, a teacher, and I teach a lot of students, and anywhere from high school onwards. And every day is a learning experience for myself.
Well, that sounds great, Dr. Chopra. So I guess the follow-up question to that would be, could you explain to our viewers what epidemiology is and why you decided to specialize in infectious diseases and hospital epidemiology?
Sure. Epidemiology is the science of determinants of health and disease. And it is very much centered around investigation, centered around understanding outbreaks and understanding determinants of disease as well as health. It is the cornerstone for healthcare and public health, which is extremely important, and healthcare outside of the four walls of the hospital. I am in my current role as the hospital epidemiologist, I'm tasked with protecting my staff and my employees and from various kinds of infections, and also in making sure I have appropriate data and understanding of that data to see how my infections are trending in the hospital, what can I expect and what can I do to prevent further infections. As we all know, prevention is better than cure. I've always wanted to focus on prevention. And when patients come to us in the hospital, my focus is that they should be able to be discharged very soon without getting a hospital acquired infection. Also, I am always keeping track of any kinds of outbreaks that can happen, and how we can prevent them and keep everybody safe.
Well, that sounds like a really interesting field to specialize in. So you kind of did touch on this a little bit, but would you mind going into further detail explaining what the daily life of an epidemiologist looks like and what you tend to do on a daily basis?
Sure. So I'm not the only one in my team. I have a team of several nurses and physicians. This is a multidisciplinary team, and I am leading that team at the Detroit Medical Center. And what I do is basically help with understanding. I work with different departments very closely, but my division of hospital epi and infection prevention is charged with the task of monitoring infections on a daily basis. My team of nurses will track patients who come with infections and also appropriately isolate those patients. So if a patient has an infection that can be easily transmitted to another patient, we need to make sure they are in a private room with contact precautions. Whenever we enter those rooms, we have to wear gloves and gowns. If a patient has influenza, for example, we have to wear a mask. If a patient has COVID, we have to wear everything. We have to wear a mask, a face shield, a gloves, gowns, and of course, make sure we are appropriately performing hand hygiene. So these are just examples of different precautions we take in different patients. And unless we know that we have a patient like that in the ED, we won't be able to isolate them. So we are involved in making decisions on appropriate isolation. We are also involved very closely with environmental services to make sure our environment is clean. We help in outbreak investigations. If there is a outbreak within the hospital and we have several patients who have the same infection, we want to find the source of that infection. We also make policies and procedures around personal protective equipment to be used inside the hospital. And we work very closely with occupational health because we are also involved with the safety of our employees. And if the employees end up having any kind of infection that is hospital acquired, we are responsible for helping them and walking them through. And also in the current scenario where we are faced with the pandemic, if an employee is exposed, we help them with testing, we help them with quarantine, and we help them with all the decisions that are related to coming back to work. So it is a list of duties that we do on a day-to-day basis. In addition to all of this, I'm heavily involved in teaching. I do a lot of research. I do quality improvement projects, which can help me prevent infections at the hospital. Not only I track infections, but my duty is also to keep them at a bare minimum. And to do that, I implement various projects with which I can decrease infections, and those projects end up turning into quality improvement / research projects. So I'm heavily involved in research and publishing, and also mentoring upcoming budding epidemiologists who are interested in the field of hospital epi and infectious diseases.
Thank you so much, Dr. Chopra, for sharing your insights. Now we're going to transition to a soap demonstration led by Jasmine, which is going to show the importance and molecular science behind soap and water. And then we'll bring Dr. Chopra back on after the demonstration to talk with us a little bit about the connection between STEM and the coronavirus pandemic. So Jasmine, whenever you're ready, you can take it away.
Okay, so as you guys can see here, this demonstration is going to be displaying how germs spread and just what the importance of soap is. So for this demonstration, you guys will need a bowl of water, some dish soap, a paper towel, and some black pepper. So for the first part, you're just going to sprinkle some black pepper in the water. And then you're just going to dip your finger in the water. And you're going to notice that I get some black pepper specks that stick to my finger. And that's supposed to mimic how germs stick to your finger when you don't wash your hands. So I'm just going to really quickly wipe my hand. And then I'm going to dip my finger in the soap. And now you're going to see that when I dip it in the water, all of the black pepper, aka the germs, they all spread apart, which shows the importance of why we should use soap when we wash our hands. And the reason for this is because of the molecular structure of the soap, which Shanmeen is going to explain to you guys in the next slide.
All right. Thanks, Jasmine, for that. So as you noticed, the black pepper stayed afloat on the water, and that's because there is a strong, unbroken surface tension on the surface of the water, and the black peppers were light enough to float on top of the water. So as you can see in this graphic, this is showing a soap molecule. So a single soap molecule has a head and a tail, shown here as a blue circle for the head and a red line for the tail. So soap molecules have a hydrophobic or water-fearing tail that fears water and is repelled from water but is attracted to fats. The other end of a soap molecule has a hydrophilic or water-loving head, which is attracted to water but not attracted to fats. So in this next slide, there are 4 types of germs. We have bacteria, fungi, protozoa, and viruses. Viruses are a type of germ that have a fat and protein coat surrounding it. And so when soap molecules come in close contact with viruses or other types of germs, the soap molecules have the hydrophobic or water-fearing tails reorient themselves. So they are no longer facing the water, but they instead attach to the fat and protein layer on the virus or germ. And then they bury themselves into that fatty layer and rip it apart, exposing the contents of the germ, and the water then acts to wash away the contents of that germ. And so that's why using soap and water together along with scrubbing is so effective at getting rid of things like viruses that might be on your hands, bacteria, or other types of germs. Keep in mind though that using just soap or just water alone does not do the trick. It's very much a team effort and also requires that you scrub your hands with soap and water for at least 20 seconds to make sure all the germs leave your hands. All right, so now we're going to bring back Dr. Chopra on screen to ask about the STEM connections. So Dr. Chopra, our next question is, with your strong STEM background, can you share with us how you have been helping in the fight against the novel coronavirus? Dr. Chopra, I think you are muted.
Okay, sorry about that. So I would say the past 4 months have really exposed us to the most unexpected scenarios, very unanticipated emergencies, and also extremely unique challenges logistically. You know, as an epidemiologist and as a teacher and as an infectious disease physician, I found myself wearing many hats during the pandemic. I was an infectious disease physician on the front lines and an epidemiologist who was tracking daily virus rates, a team leader making sure that my hospital staff is safe and all the healthcare providers are getting access to adequate masks and other personal protective equipment. I was also a clinician who was worrying about my patients on the medicine floors, and a teacher, you know, who was trying to keep up the morale of my residents, my fellows, my students. So amidst all of this, I can safely say that I spent many sleepless nights worrying about my community and my workforce, and tackling the contagion in our city of Detroit, which, as you all know, is a predominant underserved population, was not an easy task. Detroit saw a tsunami of COVID cases. We had to very quickly adapt to the ever-changing scenarios. We had multiple challenges, not only managing patients, but also preventing spread to other patients. And you know, we found ourselves dealing with a lot of unknowns because there were lots of ever evolving information about the virus. But in the front lines, to name a few challenges, I think as a nation, we all dealt with shortages of personal protective equipment. We dealt with shortages of testing kits, ventilators, hospital beds, and we had to modify strategy by the hour. I was making policies with the help of my team, and they changed. As soon as I was done making a policy, it changed in the next hour. And so pretty much our team was racing against time. And to fight this war against COVID. And the virus was not only deadly, but also very deceiving. There were new presentations of the virus. There were new modes of transmission of the virus, and we were learning something new every single day. But having said all of this, I do believe that we in Detroit are much stronger, and we learned a lot of lessons during this pandemic. I find myself and my team a formidable force. We saw some exemplary examples of teamwork, you know, which started off from our greeters in the hospitals to nurses, to medical assistants, to technicians, to respiratory therapists, you know, food staff services, and environmental services and doctors. All of them were frontline, and everybody chipped in. There were lots of volunteers and students who were willing to risk their lives and to be on the front lines and help the community. So I think I learned a lesson of kindness from each member of my family, with the Detroit family, the community, the Wayne State University family. And I will give you one example that may give you insight into how the policies were changing. So, we are now in the phase where everybody is supposed to mask, but early during March, there was not much known about the virus. And we were facing shortages of PPE. So very early on, we said only those people have to wear a mask in the hospital who are going to be seeing patients, or who will be around patients, but others don't have to, and who will be around COVID patients. Others don't have to wear a mask. So universal masking was never a part of the policy, and which may have led to a lot of exposures. So of course, I can say that in hindsight, but it is also a lesson learned. And I think what I did as an epidemiologist and as a women leader in my hospital is, even though CDC had not recommended universal masking, I did mandate universal masking around mid-March, 2 weeks ahead of CDC, because I was seeing a lot of exposures within the hospital. And I not only mandated universal masking in my hospital, but I used not surgical masks, but the N95, the hospital grade masks that were provided to each of our staff, not just physicians or nurses, but to everybody, including food services and environmental services. And I think that one action alone has saved a lot of lives in our hospital, and has also it helped us keep our staff working rather than being at home and being quarantined. So that was one. And two, I also made sure that we don't use our white coats in the hospital. As you know, white coats can be a source of fomite transmission with the virus. So we stopped using white coats and we started using hospital provided scrubs. And I think that helped us, and we are still doing the same. That was one second example of being proactive during the pandemic and thinking out of the box. Last but not the least, we requested our leadership to provide food to all the trainees, because residents and fellows became frontline providers very early on, and started working round the clock. And if they had to go step out of the hospital to hunt for food, that would be another added layer. And not only it would waste time for them to go out, but also waste PPE. So they would have to don and doff out of their gloves and gowns again and again and again. So rather than doing that, we made sure we had food for them around the clock in the hospital. So these were some of the examples. In addition to that, I will talk a little bit about our experience with working closely with the state and the Detroit Health Department and CDC, because we noticed that a lot of our patients were coming from nursing homes, and there were some zip codes in Detroit that were hardly hit. And these were highly vulnerable populations, because these were older patients. So our medical students from Wayne State University stepped in and helped us with going to nursing homes and testing the nursing home residents. So we trained them how to test, and they did nasopharyngeal swabs for us and tested the nursing home residents. So we were able to identify patients early on, because we had this huge manpower of medical students who helped us, and some nursing students who helped us during those times of crisis. So I think that when there are pandemics like this, which nobody has ever seen, the community comes together and people volunteer, and you have to think out of the box during that time, and you have to bring in some common sense to the picture, and not always follow every single protocol that has been put together in the past. So with this, I do want to end this conversation, this particular question, by saying that as a team effort, we continue to battle this pandemic. We continue to keep our community safe. We are still in the midst of the pandemic, even though our rates have gone down. We are galvanizing our efforts daily. We consolidate resources. We try to identify gaps that we can bridge. And COVID-19 has taught us lessons in preparedness. And together, we are strong enough to fight this contagion.
Well, thank you, Dr. Chopra, for that. We're obviously very grateful and very appreciative for all the work that you, along with the other healthcare workers, have put into the fight against COVID-19. So I guess that leads to our next question, which is obviously you as healthcare workers are doing the best that you can to stop the spread of this disease. So what can we do as a society to better reduce the spread of communicable diseases, specifically diseases like coronavirus?
Sure. I think that this is a great question, and you guys are already doing what we should be doing. You just taught us a lesson on hand hygiene together with the Michigan Science Center and Replenish. You've done an amazing job in describing why hand hygiene is important. So I think washing your hands and masking is not only critical, but it is an act of kindness. It is your do-it-yourself vaccine. Until we have the COVID vaccine available, we have to all make sure that we are masked, because masking is the single most important measure that can prevent community transmission and help us resume normal lives or near normal lives until we have the vaccine. Also, we should be remembering to avoid big gatherings, like as advised by CDC, by Dr. Fauci. It is critical that we avoid big parties, going to bars, going to parties where there are lots of people. You want to restrict yourself to less than 5 or 10 people at a time, and you want to be masked and you want to be socially distant. We have noticed time and again that when we have attended these big parties, be it graduation parties or birthday parties or weddings, we have had huge transmissions. And that is what we want to avoid. And we as students, you guys who have done such an amazing job in education, I think are role models for the community. And your message is very inspiring. When you talk about hand hygiene, you described a wonderful experiment where you talked about soap and water and the importance of washing with soap and water and removing the germs from your hands by the act of friction is so important. At the same time, keeping yourself masked and using the mask. How do we actually, what is the right way of donning and doffing the mask is also very important, because some of us don't know how to wear a mask. So wearing a mask in an appropriate manner, holding it by the strings, not touching the center of the mask, not manipulating the mask again and again with dirty hands, making sure your mask is always clean, are also some of the other steps that we can help educate the community.
Thank you, Dr. Chopra. That's very important and advice that we should all take as a community that I think it's important that we all follow. So our final question for you is, do you have any advice for young girls who are interested in pursuing a STEM career?
Sure. I think the one advice I would say is follow your passions and seek opportunities and seek mentors. I think a mentor can go a long way in helping you achieve your goals. You don't have to have one mentor. You can have multiple mentors. You can have a mentor in school. You can have a mentor in your community. You can have a mentor in your parent. And you can have a mentor in your peers. You can have multiple mentors who can teach you and guide you in the right direction to achieve your goals and provide you with opportunities to find the right direction in life. And there is no right or wrong answer. You may like a particular STEM field that may help you pursue another field. So you won't know unless you try. And I think we have some very, very bright young women who are interested in pursuing STEM careers, Detroit has provided with huge opportunities, and so has Wayne State University and the Michigan Science Center to help with providing with resources as well as opportunities to these young women through the STEMinista program. And I would advise young girls to seek out these opportunities and always try.
Thank you for that wonderful advice. So that just about wraps up our interview questions for you, as well as the demonstration for Let's Talk Germs. So I guess now we'll be taking any questions or comments that have been posted in the comment section, if there are any.
All right, so it sounds like there are no questions in the comments section, which is totally fine. So we'd like to take this time now to thank all of our viewers who did the demonstrations alongside us or watched and heard from our amazing STEM female role model today, Dr. Chopra. We also wanted to thank the STEMinista project and the Michigan Science Center for co-hosting with Replenish Detroit today. And a special thanks to Dr. Chopra for sharing with us her insights and experiences as a frontline worker and frontline fighter against the coronavirus pandemic.
Thank you, guys. Thank you for having me, and good luck to all of you.
Thank you. We're so happy that you were able to join us today.
I just wanted to thank you guys for joining us today, our friends from Replenish Detroit and Dr. Chopra. We are so appreciative that you spent your time with us this morning. Your commitment and expertise is really, really valuable to us at the STEMinista project, and more importantly, the Michigan Science Center. So thank you all for your time, and thank you to all of our audience that joined us today. If you joined us late, I'm sure you'll be able to start the beginning of this video and catch up and definitely experience all of the wonderful things that we talked about, especially the interview with Dr. Chopra, which I believe is really critical during this time for our community to stay tuned to. So without further ado, we hope that you'll stay connected with the STEMinista project. Definitely follow us on Instagram or Facebook, whichever is your preference. And we hope to see you at some point this week during our Echo Live presentations, which you can find out more about that on our Michigan Science Center Facebook page. So without further ado, we will say goodbye to everyone, and thank you again for joining us. Bye.